In progress. In progress.
Caitlin, you asked me what classes I would be teaching next semester. Do you remember asking me that?
Yes.
I am not teaching 122 next semester. I
Okay.
know. I thought that was a little odd, but they asked me to teach 2 sections of 121. So this same class.
Gotcha. Well, it was worth a try.
Yeah, I apologize.
That's
understand.
okay. I just, like with you and Bacon, I've told myself I would never do an online class, and here I am. So I've gotten like used to the way that you guys teach. And AMP2, I heard, is just not harder, but more concept, like deeper than what we go now. And I've already gotten used to you guys, so that's why I asked.
You know who I would, the one, at least one person I know who, I don't know a lot of people with hack,
Mm-hmm.
but Ruth Negley is really good.
Okay.
I would look up her.
Noted.
She does it almost all by videos. So you'll probably will not have a lot of contact with her,
Okay.
but she does all videos, which means that you can really do it on your own time.
Okay.
You guys, let me give you that name just for anyone else who's wondering. I don't, because I got hired during the pandemic,
Mm-hmm.
and hack is really all over Pennsylvania.
Yeah.
I live in Hanover.
Okay.
I can tell you that my chair, I've never met face to face. He's a nice guy. I now, as of a couple of weeks ago, have his cell phone number, but I don't know a lot of people who are specifically with hack.
Okay.
But Ruth Negley is the main AMP person with the Gettysburg campus. And I know that the students last semester really liked her.
Now, does she do like what we're doing now, where like you have to sign in with Zooms on class, or is it literally just all
so.
by
I
yourself?
think it's just videos. I think it's
Oh.
just videos.
Okay.
And she's pre-made them, and I think she honestly not. I'm a teacher in the learning curve. Like I'm still figuring out how to do it a lot of times.
Mm-hmm.
She's been doing it for a long time.
Okay.
And students say that she's really, really good. And I have talked with her online, and I think she's a good person.
Awesome. Thank you. It takes, I mean, rather than shooting in the dark, at least to have somewhat of a
See if you
person
can't. See if you can't
book
grab
with.
her. I don't know other professors who teach 122, but I know she does.
Okay. Yeah, because I think this week we can start, like if we're already pre-existing, we can start looking to register for next semester.
Look at her. I'm trying to think who else teaches labs. There's a shoot, I knew her name at one point. Give me 1 second. I'll try to look just for a moment here. another professor, and she does teach like we're doing right now remotely.
Mm-hmm.
Her name is Nancy. I think I have her cell phone number, maybe. Nancy. I think it's Knops or something like that. Let's see here. I think it's going to be quicker for me to look her up this way.
Professor, please, I have a question.
Give me 1 second. Her name is sorry, be patient with me as I figure out what I'm doing here.
Oh, no, you're fine. Like I said, any information is better than shooting in the dark.
Right. Her name is Nancy Kanopka. And she is a lab technician for, I think, she only teaches evening labs,
Okay.
but she teaches like we're doing here. And so I think she teaches remote still.
Okay.
And she teaches, she tries to do the one thing that's really hard with online labs is online labs tend to be you listen and the teacher teaches.
Mm-hmm.
And labs honestly should be more hands-on.
Right.
And she tries to do that.
Gotcha.
And she has a lot of ideas to move things that direction. And so I would look for her name also.
Okay. Thank you.
You're welcome. What was your question, Toya?
My question is, will your class be online next semester?
I will, but I'm only teaching 121.
Oh, okay.
Look up these names right here. Toyin,
Okay.
look up these names. She teaches the lecture for 122. She teaches the labs.
Okay, because I'm in Irisburg, so I just picked this from Gettysburg. So I'm trying to I just like the way you're teaching, so I just want to ask whether so as to pick it for the next semester.
Yeah.
Too.
Both of these professors teach for Gettysburg also.
So I don't know whether it's going to be online next semester, so I can pick them too.
That's what I would look for first. See, it will tell you when you register, it will tell you if it's online or remote. I am pretty sure Ruth would teach probably both. And Ruth Negley. And I would think that Nancy Konopka might do the same thing. But they're both really good. When I taught the 122 lab last semester, I got in touch with Ruth Negley, and she told me to get in touch with Nancy Konopka. And Nancy Konopka gave me a lot of good ideas about what to do with that lab and how to make it better for the students. And so I highly recommend her. All right. So I want to finish chapter 7 today and see if we can't start chapter 12.
Oh, let's see. If it's due tomorrow, it's fine. All of the chapter 7 stuff, I believe it's, if you didn't already push it out, I think it's all said to be due tomorrow.
Well,
the 27th, which if it is, it's fine. I was just double checking.
I still would like to have it due tomorrow.
Okay.
Let's see how quickly we went through this, and let me think about it between now and the end of class.
Yeah, it's fine. Like, just just checking. I mean, 'cause I know a lot of like the hack website dates and a lot of the like the smart book dates, they're very different. Like when I log into the hack site and look, it says I have like 5 missed assignments, but I already did them all. And
Ouch.
I've already gotten grades for them all too.
Ouch.
So it's very, I don't want to say confusing because I know what I'm looking at, but it's very different in how like things are listed. That's why I was just asking.
I can understand that.
I also didn't see a practice test for chapter 12. I don't know if there is one. But
I thought there was. Let me look after class,
okay.
and I will. If it's not there, well, all right. Let me look now. Never mind. Let me look now, because that's kind of important. Let me look. It should be there. Let me.
I'm talking about the practice. Is that
The
there?
chapter 12 practice. It should be there.
Okay.
The chapter 12 quiz is not there. Is this, bear with me, just, nope, this is the wrong class. Shit. Sorry, give me one moment. Oh, chapter 12. No, it's not there. All right, just 1 second here. Actually, before I do that, let me look at it. All right, I'm not going to assign this right now because I need to change the points, but I will assign it this afternoon. It will be there. Give me about 2 hours after class and it will be up. One second here. So mineral deposition. The crystal, this is the process by which the crystals are deposited in the bone as hydroxyapatite. The crystals is a calcium phosphate salts. So the osteoblasts lay down the collagen fibers. Remember, that's the osteoid tissue that spiral along the osteome. The collagen fibers get encrusted with hydroxyapatite that then harden the matrix. If you've ever watched the building of crystals, guys have kids, get them a crystal kit for Christmas. But they start as, it takes a little while for the first crystal to start growing. But once the first crystal starts to form, the rest of the crystal builds a lot faster. And it starts to grow a lot faster. The hydroxyapatite crystallization occurs the same way. So it starts initially kind of slow, but once it starts forming, more ions are attracted and it builds up faster and faster and faster. So this is a positive feedback loop. The first one starts it, then it just keeps forming faster and faster and faster. Well, we also have where the bone gets broken down. So we get it deposited and then there's a balance with it getting broken down or resorbed. The mineral resorption is the process by which we dissolve the bone to release the minerals into the blood. Osteoclasts have calcium sensors that sense when the calcium levels are low. And when there's low levels of calcium, the osteoclasts that reside in these resorption bays on the surface of the bone, more specifically in the endosteum, will secrete hydrogen chloride or hydrogen ions into the resorption base. And at a pH of around 4, the proteases, remember ACE is always an enzyme. Anything that ends in the word ASE is an enzyme. The protease is a protein that breaks down, is an enzyme that breaks down proteins. And in this specific one, it breaks down collagen fibers. And when it breaks down the collagen fibers, it releases the minerals. Which of the following best describes the process of bone resorption and bone remodeling?
Is it A?
It's A. How did you know that?
Because we just talked about the ACE, and ACE is an enzyme and how it breaks down and degrades collagen.
Right. So calcium blood levels and calcitriol. Calcitriol is the form of vitamin D. We're pretty familiar with vitamin D, whether we realize it or not, because a lot of milk is supplemented with vitamin D. Calcitriol is produced sequentially in the skin, liver, and kidneys. So dehydrocholesterol in the skin is converted to cholecalciferol via ultraviolet light. This cholecalciferol is moves through the bloodstream and enters the liver, where it's then further changed to calcidiol. Afterwards, it enters the bloodstream again, and when it reaches the kidneys, it's converted into calcitriol. Calcitriol is the active form of vitamin D that increases bone resorption, reduces the excretion of calcium via the kidneys. So we lose less calcium via our urine, keeping more in the blood. And it increases the absorption of calcium and phosphate in the small intestines. So calcitriol increases calcium absorption via the small intestines, increases calcium resorption by binding to osteoblasts and inhibiting them. Remember, osteoblasts are the ones that are taking calcium out of the blood and putting them on and putting it into bone. So it binds, so calcitriol binds the osteoblasts so that they can't keep removing calcium from the blood. And they stimulate stem cells to form more osteoclasts, which will work to break down the bone to increase the levels of calcium in the blood. Moreover, calcitriol is going to promote the reabsorption of calcium in the kidneys, or so that less calcium is lost in the urine. So the net result of calcitriol is that it's going to increase blood calcium levels. Doing it through 3 different ways. Keeping more kidney being reabsorbed in the kidneys. Getting more calcium reabsorbed in the small intestines. And causing more bone to be broken down to release calcium into the blood. During hypercalcemia, another hormone comes into place. This is calcitonin. What does hypercalcemia mean?
Too much.
Too much. So too much calcium.
Too much calcium in the blood.
Right. Too much calcium in the blood. So calcitonin is released from the parafollicular cells within the thyroid gland. It has an important role in children, but only a weak effect in adults. Calcitonin is going to reduce osteoclast activity. So it's going to reduce breakdown of the bone, leaving more calcium in the bone. And it's going to increase the number and activity of osteoblasts so that more calcium is deposited in the bone. So it's going to result in more bone buildup by taking more calcium out of the blood and putting it into the bone. So calcitonin, when there's excess amounts of calcium, hypercalcemia, calcitonin gets secreted. It reduces osteoclast activity, therefore resulting in less bone resorption or less bone breakdown. It's going to increase osteoblast activity, resulting in more bone being deposited, more calcium being removed from the blood and put into the bone. And overall, this is going to lower blood calcium levels. So calcitriol, remember, this is the one that raises blood calcium levels, mainly through increasing calcium absorption via the small intestines. Calcitonin is going to lower blood calcium levels by inhibiting osteoclasts and stimulating osteoblasts. So calcitriol is going to increase calcium absorption via the small intestines. Increase the amount of calcium that's being retained in the kidneys, so we lose less in the urine. And promote bone breakdown to release more calcium into the blood. Calcitonin is going to inhibit osteoclasts. So there's less bone being broken down, and stimulate osteoblasts to remove calcium out of the blood and put it into bone. So calcitonin and calcitriol are going to have antagonistic effects. Parathyroid hormone is going to work similarly to calcitriol. Parathyroid hormone is going to sense when calcium levels are low, and it's going to bind to receptors on osteoblasts, inhibiting osteoblasts and stimulating osteoclasts to promote bone resorption. Also, calcium reabsorption in the kidneys is going to be promoted. So this is working in relationship to calcitriol. And it also works to promote more calcitriol from being made, which will enhance the calcium release. So collagen synthesis is inhibited by osteoblasts. So overall, if you increase the parathyroid hormone levels, you increase the blood calcium levels. In a patient whose parathyroid glands have been removed, you would expect that person's blood calcium levels to what?
A, decrease.
Why do you
Isn't it
say?
Because the parathyroid controls the calcium balance.
How does it control the calcium balance, Kevin?
Ooh. that is more than I know.
Through negative feedback?
It does it almost through a negative feedback loop. But yeah, Kevin now regrets ever starting to answer the question.
I always know you got to catch me when I answer a question. So.
It would cause them. So if you remove the parathyroid glands, you remove any parathyroid hormone from coming in, right?
Yes.
So if you remove that, you're going to cause blood calciums to decrease because it's not going to get elevated.
Okay.
Does that help?
Yep.
So parathyroid hormone secretion is going to increase osteoclast activity, causing more bone to be broken down. It's going to reduce osteoblast activity, causing less calcium being removed from the blood and put on the bone. Is going to promote more urinary phosphate excretion, which is going to prevent hydroxyapatite from being formed. Remember that hydroxyapatite is a calcium phosphate salt. So if you remove phosphate, you're not going to be able to produce hydroxyapatite either. And it's going to promote less calcium being excreted via the urine. Any questions? So overall, like Kevin said, it's going to cause blood calcium levels to go up. Phosphate homeostasis. So phosphate is vital for the DNA, RNA. If you remember, both the DNA and the RNA are made with a sugar phosphate backbone, which means that if you don't have enough phosphate, you don't have enough for DNA and RNA production. Also, adenosine triphosphate has 3 phosphate groups with it. Phospholipids always have a phosphate attached to them. The average adult has 500 to 800 grams of phosphorus, with 85 to 90% being in the bones alone. So similarly to the way that calcium is regulated, phosphate's regulated the same way. If you release hydroxyapatite into the bloodstream, you're releasing both calcium, you're elevating both calcium and phosphate levels. Because that's what hydroxyapatite is. It's a calcium phosphate salt. So whenever we're breaking down bone, we're releasing both calcium and phosphate into the blood. Whenever we're building up bone, we're taking calcium and phosphate out of the blood. Last part of this, this chapter, orthopedics. Orthopedics is a branch of medicine dealing with the prevention and correction of injuries and disorders of bones, joints, and muscles. It includes the design of artificial joints and limbs and the treatment of athletic injuries. An open fracture is one in which the broken ends of a bone protrude through the skin. A closed fracture is when it doesn't break through the skin. A non-displaced fracture is when the bones get broken, but they remain in proper alignment. A displaced fracture is when one bone, at least one bone, is shifted out of alignment by the break. A comminuted break fracture is one in which the bone is fractured in more than in 3 or more places. A green stick, which is most common in children, is where the bone is incompletely broken on one side and the other side is just bent. You guys, my mom left and she locked my one cat in my bedroom and he's just meowing. So let me go, do me one favor, I'll be right back. When bone breaks occur, there's three basic phases or 4 steps. The first step is a reactive phase in which there's an early inflammatory phase. Remember that the bones are highly vascularized. So over the period of several hours, a large blood clot is going to form or a fracture hematoma. Over the next 3 weeks to 3 months, there's a reparative phase, which includes the formation of a fibrocartilaginous callus. This is a soft callus. And then the formation of a bony callus. And then the last phase is a bony remodeling phase, in which the bony callus is remodeled. This healing can take months because calcium and phosphate deposition, remember this is osteoblast work, is a slow process. A closed reduction is when bone fragments are manipulated back into position without surgery. An open reduction is when surgical exposure of the bone is used and plates, screws, or pins are used to realign the fragments. I show this X-ray, and I think I mentioned it the last time. So this is my most current panoramic of my jaw. About just a little over 20 years ago, I was in a head-on car collision. And in that collision, I was wearing a seatbelt, but I was sitting too close to my steering wheel. And if you are sitting too close to your steering wheel, if you're sitting within 12 inches of your steering wheel in a head-on collision, you will go forward and hit your steering wheel. And I learned that the hard way, because when I was in this collision, I hit a median head-on. And when I hit the median head-on, I hit it going about 45 to 35 miles per hour. And when I did that, I was within that 12 inches of my steering wheel. And I went forward and hit my, bear with me. I went forward and hit my steering wheel like this. And luckily, I don't remember a whole lot about that part of it. I remember going into I remember hearing my car crunch. And then I remember coming back and up into my, sitting back up after I'd already done the damage. And what I did is I broke my lower jaw in 4 places when I did that. And I shifted it out. So when I hit it like this, I went forward and I shifted it over this direction. And so looking at the bottom jaw, I had a break where I had, let me do it, show it this way. I had a break right here. I broke it both right here. And then I broke it right here. And I had an open and complete fracture, which means that my jawbone came out the bottom of my chin. And if you look,
That's amazing.
yeah, it is, and it's a great story. It's a great story. But
Sure,
if you look at the bottom of my chin, I have a scar that runs about an inch across the bottom of my chin. From about right there to about right there. Somewhere right in there. And I don't remember an extensive amount about, I remember a fairly good amount. I remember coming back up into my seat and knowing I didn't understand what had just happened. They actually ended up blaming it on mechanical failure of my car. And I didn't really understand what had happened, but I knew I'd been hurt. And I knew I'd been hurt pretty badly. I just remember there being a lot of blood. And looking at my jaw and realizing that it had been shoved over in this direction. And what happened was that I broke it here and I broke it about right here. And so this plate right here is essentially stable, is right across those 2 breaks down there. And this up here is a whole nother story. I was born with a cleft lip and palate. And so what that means is that my palate, when I was born, the 2 parts of the maxilla that come together to form your palate did not close. And so when I was about 12 years old, they went in and let me start a little earlier. I had braces. I wore braces for about 8 years. I wore them for about maybe 7 years, about seventh through 8th, 2nd grade through 8th grade. I was in braces. And my orthodontist finally realized that the only way that he was going to get my teeth to stop moving, my top teeth, and stop shifting was if I got more bone in the top of my mouth. Mm-hmm. And so when I was approximately 12, 13, 14 years old, they went in and broke both of my jaws, surgically broke both of my jaws and shifted them and took some bone from my hip and put it up in the roof of my mouth. And when they did that, these chains are there to support that graft that they put in there when I was about 14 years old.
That's because they were so close to the sinus.
Yeah. And so that's what these chains are all about. I have a bridge because with all my dental work that I had done, eventually they put in a bridge across my teeth right here. But what I want to bring up with this is if you notice, if you've ever looked at your panoramics, at a normal panoramic, this tooth right here is barely in there.
Yeah. You don't have much bone left.
I don't. I have very little bone. I have,
They have mobility of some of those teeth up front.
how did you know that?
I've been in dental for about 10 years.
Wow. Yes,
I know exactly what you're looking at right now.
this little bone, this tooth right here is.
You're actually missing one.
I'm actually,
in the front.
all right, Brittany, you're jumping ahead here. You're ruining my story. But you're right. So this little tooth is right here. It sits behind all the other teeth. I can shift it around. And I can actually shift almost like Brittany is saying, from about right here to right here. I can move all of those teeth. I can watch them move as I floss and brush my teeth. This little one back there is just barely in there. And the reason for all that was that every time bones break, they remodel.
Yep.
And when my jaw got broken, my chin narrowed a little bit. And so what it did initially when the bone remodeled is it started pushing out these bottom teeth. And so I lost the one right there, like Brittany said, about 3 or 4 years ago. These teeth right here have become very, very mobile. And like I said, I can watch them move when I floss my teeth. They don't really stay in one place. And I'm really careful what I eat because I'm doing everything in my power right now to keep my teeth in my mouth as long as possible. But eventually, I know, and I always tell my dentist, I'm working with a dentist that I go an hour away to, but I love him. And so I would never change dentists. That's why I travel an hour to him. But I go to this dentist and he knows, and I know that we're essentially straightening the chairs on the Titanic. We know that the ship's going to go down eventually, but let's keep it floating as long as possible. And the reason why they're continuing to fall out is because of the initial bone break. When I broke my jaw in the car wreck, I told you that I broke it along both TMJ joints, and then I broke it across my chin. When I broke it across both TMJ joints, when they went back to put it back together again, they missed something. And I don't have any malice towards them, because looking at my mouth, and I told you that, coming back up into my seat after hitting that median, I knew that I was hurt, and I knew that I was seriously hurt. And I can't imagine what the orthopedic surgeon saw when he looked in my mouth, because your mandible is not very big. And I'm a fairly small person overall. And breaking it in 4 places is a lot on a very small bone.
And also you have that main nerve that goes on both sides of the mandible that they do blocks on.
Say it one more time.
So you have where your screws are, this plate there. Over here where there's this, it looks like an open condyle, really, like this tubular thing. It's more.
Where are you looking?
I'm trying to, right there, all the way up here on both sides is a main nerve where they do your blocks at. which is what causes you to get numb. So they could have, all that main nerve leads into all of the teeth and all the nerves around the teeth, and that it really is like the main factor of like the blood flow in the mandible. So I mean, whenever they were placing that back together, they could have done something in
Really?
that area. So do you ever have a hard time like getting numb?
I don't, you know what? I have really weird innervation in my mouth now. I don't feel a lot of things.
Yeah.
I had this molar removed, and my dentist wondered if it was going to make me sick or make me not feel well. I didn't feel a thing.
Yeah, it's something. Whenever you broke the jaw in 4 places, you know, it could have done something in that nerve area that has caused something to not, you know, not rebuild your jaw back the way it needs to.
Wow. See, I always learn something, but I've also learned that the TMJ joint is the jaw is out of alignment.
Yeah, that's why the orthodontist did jaw surgery for you, because he wanted to realign it.
No, he couldn't do that. He couldn't do that. That was prior to the wreck.
Okay.
So that happened when I was the time when they realigned my jaws, I was 12 years old.
Okay.
This wreck where I broke my jaw, I was 27 years old.
Okay.
And so this happened when I was 12. This happened when I was 27.
Now, when they realigned your jaw, did you have to do the face shield thing, where you had it just depends on how your bite was really.
So I ended up having my jaw wired for 2 months.
Okay, so you didn't have to wear the glorious thing to sleep at night. So you
thankfully, no.
Yeah, that thing is dreadful.
All right, Brittany, I want to talk to you about this later, but let me finish this story for right now so we can go on with class. I'm curious what you're going to tell me, because you're telling me things that I didn't know. But the reason that these teeth are continually part of it may be what Brittany's getting at, in that there's a reduced blood flow. But why is it continuing to occur 20 years after the fact? Because this wreck happened May 30th of 2001. Talking with my dentist most recently, it is because they're out of alignment. Because and you can feel it when I open my jaws, you know that they're not moving correctly. They feel differently. And this part of my jaw is more indented, it's more shifted more to the side here. And so what's happening is every time I bite down, I'm putting pressure on these teeth and moving them more horizontally. And the result is that I'm slowly shifting them out. And my job right now, because I have dental insurance through my dentist, but being a part-time instructor, I don't have insurance through any of my schools. But overall, in the long run, we'll probably go in and give me, I don't have enough bone to support implants, but we will probably go in and give me like a part denture, partial denture thing. But right now, I'm just trying to keep my teeth in my mouth because teeth are really, they're vitally important to your speech and how you sound. And being a teacher, I really need to be able to talk and be clear in my sounds. And I have really, 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 really good gums. Whenever I go and see a new dentist, the first thing they want to do is their first feeling is, why aren't you seeing a periodontist? But then they start looking at my gums and realize there's nothing wrong with my gums. My gums are actually exceptionally healthy. I don't have any bleeding in my gums. I rarely have a lot of plaque in my teeth because I also take really good care of my teeth. But I'm still losing those teeth gradually. And I show this, and it's a hard thing. I wouldn't wish it on my worst enemy to go through an adventure like this, but it's an amazing story. And I asked for a copy of my panoramic because every time I got a new dentist, all the dentists that worked in that practice would come and look at my panoramic because it's so bizarre looking. And so I finally asked for a copy of it. So outside of all Brittany's questions, anyone else have questions?
No, God bless you, but that looks painful.
It's not so painful now because I just don't feel a lot of things in my mouth. I did have on one of these teeth, and maybe this one right here. It had to have been this one. I had a root canal done. And my dentist was, the guy who did it was like, I'm not sure if you're going to struggle with pain later. I went to work right afterwards and I was fine. And I just don't feel a lot. When this tooth started to rot out of my mouth, I didn't even realize there was anything wrong with it. And so and maybe it's what Brittany's talking about, but I don't know how that would affect the upper jaw. I know that there were some minor breaks to my upper jaw. I know that it was a really good break because I have multiple broken teeth in my mouth. And I have multiple broken teeth to this day that have never decayed. But if you know, tooth enamel is by far the hardest thing in your body. And so for me, if I think about it, breaking that many teeth, and I broke at least 6 or 7. Breaking that many teeth says something about how hard that hit was. And Brittany, I really do want to talk to you about this X-ray later. Because you're telling me stuff that no, I didn't know that. I didn't know that. And I like learning more about it because first off, it helps me understand it. It has been difficult knowing that they're just slowly falling out. But I like learning why. So I appreciate it.
Of course.
Osteitis, some additional bone diseases. Osteitis deformans is a proliferation of osteoclasts and resorption of excess bone. It's also called Paget's disease. Results in weak remodeling and deformed bones. Osteomyelitis is usually caused by a bacterial infection and it's an inflammation of the bone. Osteogenesis imperfecta is a collagen disorder. Osteosarcoma is a bone cancer. Any questions about chapter 7? Let's move on. So we will notice, and I do want to get caught up. I think if I'm going to do a recording, I don't want to do a recording of this chapter. I may do a recording of the autonomic nervous system, but I don't want to do a recording of this chapter because the autonomic nervous system is a fairly short chapter. And it's not, once we get there, it's easier to comprehend. And so I don't want to do one of this chapter. I prefer to wait. I don't want to do recordings of what I know tend to be more difficult chapters. If I'm going to do a recording, I prefer it be an easier chapter. So be patient with me and let me see if I can't just get us caught up. And if I can't get us caught up, then I will do some recordings. So nervous tissue. Neurology is the branch of medical science that deals with the normal functioning of the nervous system. The neurons are the nerve cells. The neural glia are the cells that support the neurons.
Are you, did you pull up another slide? It's not showing.
Oh, is it not showing? Let's do
No.
something different here. Thank you for saying something. What about now? Okay.
Yep.
I appreciate you guys saying something and not letting me sit here and talk for like 10 minutes and not be able to see anything. So there's two main organ systems that are dedicated to maintaining the internal coordination of the body, and it's essentially maintaining homeostasis. They are the endocrine system that communicates via chemical messengers secreted in the blood, and the nervous system that employs both electrical and chemical means. The endocrine system is a little slower to respond, but it's longer lasting. If you think about it, something has to happen. That signal has to move in the bloodstream to wherever it's going to go. And when it gets to wherever it's going to go, it's going to produce hormones that then have to be secreted into the bloodstream. And those hormones have to float around in the bloodstream until they finally reach the target that they need to go be at. And then they activate that target and the response occurs. Well, that takes a little while. Also, if we want to get rid of those hormones so that that action stops happening, that takes a little while too. So the endocrine system is slow to respond, but it's longer lasting. The nervous system happens very fast. If you think about electrical conduction, how long does it take for you to plug in a fan and then have the fan start? Not more than a couple seconds, if that. I don't think it even takes a couple seconds. I think it's more like a second. Nervous system is, the electrical is very fast, but it's going to be easily stopped too. So it's faster to respond and shorter in how long it's going to respond duration-wise. The nervous system carries out its task in 3 basic steps. Initially, there's a sense organ that receives information about the body and its in changes within the body and the external environment, and transmits a coded message to the brain and spinal cord. And the brain and the spinal cord are the central nervous system. The central nervous system then processes that information that's coming in from the sensory organs and compares it to past experience and determines what's the appropriate response, or should there be a response. If there should be a response, what should it be? Sometimes we just don't respond. If we're going to respond, the central nervous system then issues a command via another neuron to say, this is what you need to carry out. And the muscle or the gland cells are the effectors that carry out that response. Do you see the feedback loop here? Do you remember talking about feedback loops? So we receive a change, something happens. This afferent neuron afferent or afferent always means incoming or approaching or arriving. Incoming, arriving, or approaching. Efferent is outgoing or exiting. So the afferent neuron sends a signal to the central nervous system, the integration center, saying this is what's occurring. Integration center decides what is it going to do with it? What should the response be if we're going to respond? And sends the information by an efferent neuron back to an effector, and that effector carries out the response. So these are the two divisions of the nervous system working together. The central nervous system includes the brain and the spinal cord. The peripheral nervous system includes the cranial nerves and the spinal nerves. Cranial nerves are going to come almost all of them. We refer to them as 12 or 11 and a half pairs, because we're going to learn that one of the cranial nerves has a branch that comes off the spinal cord. The spinal nerves all emerge off the spinal cord. So the cranial nerves come right off the brainstem. Spinal nerves come off the spinal cord. The central nervous system, the brain and the between brain and spinal cord are enclosed and protected by the meninges. these layers that are continuous that surround the brain and the spinal cord, and the vertebral column. The nervous system is composed of nerves, which are a bundle of nerve fibers wrapped up in fibrous connective tissue that emerge from the central nervous system via some foramina of the skull and carry signals to and from other organs of the body. The ganglia are not like swellings in a nerve where the cell bodies of the peripheral neurons are located. So nerves are going to be predominantly axons. Ganglia are going to be their cell bodies of the neurons. I'm going to introduce some words and we'll end here. Let me introduce a few more words here. If you decide you want to jump ahead, I just want to introduce some words to make it a little easier for you. So nerves, bundles of axons, and the peripheral nervous system. Tracts are bundles of axons in the central nervous system. Ganglia are cell bodies in the peripheral, groupings of cell bodies. I know we're out of time. I'm just going to type these words in here and then we'll be done. Bundles of cell bodies in the peripheral nervous system. Nuclei, which you know what a nuclei is, but it's got a different, it means something different when we're referring to the nervous system terminology. A nucleus or nuclei are bundles of cell bodies and dendrites, which we'll talk about next time, in the central nervous system. Keep those words straight. You'll make your life and my life a lot easier over the next couple of weeks if you learn those words really well. These words, afferent and efferent, learn those words because you will see them over and over again throughout physiology. You guys have a wonderful 2 days, okay?
You too.
You too.
Thank you.
You're welcome.
Thank you. Bye-bye.
You're welcome. Brittany, Kevin, and Alex, are you still here?
Yes.
Hi.
Hello.
Do you have a question, Brittany?
No, I just wanted to make sure that you received my doctor's notes. I sent you emails.
When was it?
It was, I think it was either last week or the week before.
I probably did. I'm not, when you miss class, I take your word for it. I'm not,
Okay.
if you're missing class, you know, Brittany, obviously you know your stuff.